Hello. Today I'm going to talk about fillers. At Iowa Plastic Surgery, I've been using fillers now since they first came out. Um, 20 years ago, we had just collagen. Um, for those of you who remember, it only lasted a short time, but did get an effect. Other fillers have been out now 15 years, but as time goes by, they become more and more specialized. The United States, we have probably over 10 products, which is interesting because in Europe, it's many, many times that. Not that they have better, it's just more brands. In the United States, our major companies are Allergan, Galderma with the Restylane line, and MERS with Radiesse and other products. Um, First, I'm going to talk about the Juvederm line, which I'm going to show you here. The first products were regular Juvederm. It was good everywhere. You could inject it in the nasolabial folds, which where it was approved from first. You could inject it in lips. You could inject it in cheeks. Those areas were all off label, so to speak. In other words, they had only gotten their studies and FDA approval for the nasolabial folds, but physicians, as a matter of training and a matter of application of medications, use products off label all the time. The regular Juvederm was a good workhorse. It's evolved into Juvederm of several types: the Juvederm Ultra, the Juvederm Ultra Plus, and then the XC. The XC just means it's got some additional lidocaine inside of it, so it numbs as it injects. The Plus probably lasts a little longer than the regular Juvederm, but it is a little firmer as a trade-off. But it's a great product for those who have, say, I want a little just in this spot here, and a little in here, and a little in here. It's a great product because you can apply it in all those spots with one syringe. Now, of course, all the products, when I talk about one syringe, means you're buying it by the syringe. You don't go into a physician and say, I want this corrected, and we give you a price and we completely correct it. We unfortunately have to tell you, well, it could take more than one syringe, and it depends on how much you want to spend. So all fillers are by the syringe rather than by the cure, in that fashion. Other good things to know about getting a filler: try to avoid aspirin and Motrin and Nuprin or any medications that cause bleeding for 2 weeks before, because that'll minimize your bruising. You could get swelling and bruising from the treatment, and I'll be talking a little bit more about the various degrees of swelling from the different fillers. Rarely you can get lumps, although with many of them they can either be molded away after treatment or dissolved. All the hyaluronic fillers, the whole Juvederm family that I just showed you here, or the Restylane family, are all hyaluronic acids. That's a gel that's very similar to a molecule that's in our knee joints, so it's really biocompatible with the body. It dissolves slowly over time, but if for some strange reason it turns out badly, it can be reversed by injecting an enzyme called hyaluronidase. You also want to go to somebody who knows what they're doing anatomically, because there have been cases where the filler has been injected directly into an artery, resulting in permanent damage to tissue or skin. So the Juvederm family is what I'm going to talk about first, and I just talked about the regular Juvederm, which is kind of a workhorse to go anywhere. Then they came out with specialized Juvederm. So there's Juvederm ValBella, Juvederm Vollure, and Juvederm Voluma. Voluma, as it would imply, is for volume. So my number one area that I injected is cheeks. As people age, gravity pulls the fat down, settling lower. So what used to be up here is down here. See, as if I push this up, and as you do that in the mirror, you look more youthful. So the filler becomes a camouflage by reinflating the cheeks. In a way, it also helps the nasolabial folds, because if you look at younger people, they have those folds, but what they don't have is the loss of volume in here. So inflating it in here will hide the nasolabial folds. So when fillers first came out, I was injecting a lot of nasolabial folds because that's where we had the approval and that's where we were told. But now I inject far more cheeks, which makes the whole area look better by camouflaging that. The other thing the volume in the cheeks camouflages is if you have that dark circle under your eyes, which is due to the muscle at the orbital rim showing through the thin skin and the fat falling down. By adding volume in that area, it camouflages it. It doesn't take away the dark circle. Initially, people tried injecting fillers right at the tear trough, but that had a lot of swelling and lumps and visibility, so that's not done very often anymore. So Voluma is the one I like for cheek volume. You could also add it volume around the jawline if somebody wants a little bit more definition there too. A syringe of that can last up to a year, but when I say a year, it's slowly declining the whole time. It doesn't mean you have the whole effect level for that year and then it abruptly goes away, which would be great for my business because people would look good one weekend and the next weekend they'd go, my face is gone, and they would call and make the appointment. With it being gradual, they don't notice it as much. You can do more than one syringe, and I'd say a good third of my patients will do more than one syringe. We usually start by putting a half on each side. The next product I'm going to talk about in that line is Vollure. Vollure is another Juvederm filler. It's good for the nasolabial folds. It's good for deeper lines. It holds up a little better than the regular Juvederm, and it has less swelling. So it lasts about a year, has less swelling, and so it is my favorite for the nasolabial folds. The third product I'm going to talk about is ValBella. ValBella is my favorite for the lips, and the reason being, much less swelling. Regular Juvederm or some of the other products I inject will have not only the mechanical swelling from injecting it for a day or two, but will draw on water, and people will have 2 weeks of swelling. Now, my younger patients may not mind that, but a lot of my older patients or my patients that have jobs that are more conspicuous are bothered. And so ValBella has become my favorite because there's a lot less swelling. It also holds up longer. It also allows more definition. So it's good for the lip lines, it's good for lip volume, it's good for defining the lip edge. And it comes in both a half cc and a full cc, so for those who either just want a little touch up or are very cautious, they can do as little as a half a syringe. I've also put it in the glabellar lines also. Again, another area that you have to know the anatomy well. Now, when I assess people, and I do all the injections myself, I don't delegate it to a nurse or somebody else. I think it needs my artistic talent. I think it needs my years of experience with anatomy. I think it needs my decision making as both a surgeon and a physician as to what they need best, is what's the best use of their money, and their best results. So they get all of that, and I hope a higher degree of safety by all of that. Of course, right now we're injecting it under COVID with a special filter that people can breathe through. It's an N95 level filter that makes it safer. So that's our Juvederm family. Those are all injected in the office, all take only maybe a half an hour to do between evaluation and preparation and injection. Most people are good to go the next day, but I can't guarantee it. A few people bruise more than others or swell more than others. But most people can, there's no downtime and no recovery. Another filler I want to talk about today is Radiesse. Radiesse is from MERS. Oops. And Radiesse has been around a long time already. I probably have been using it over 15 years. It's a great product if you know how to use it. Again, it's good for structure. A syringe of this is a cc and a half. These are all 1 cc's or less. Because it's a different product, hydroxyacetate, which is more of a paste type molecule, and that paste gives better support. So it's my best one for deep marionette lines. Not good for superficial marionette. If somebody has a combination of both, I might say, well, we need to do a Radiesse Deep and another product like Juvederm on top of it. But Radiesse gives much better support. Also because the material will integrate with tissue and sometimes get some scar tissue to replace it. I have had patients say they have a very long-lasting improvement in cases. And it being a cc and a half plus the greater structure, I think one of these can be equal to 3 of the regular Juvederm in cases, making a very economical product for when we need support. The drawbacks: can't be used for fine lines, and it does have a little tendency to lumps if you don't know what you're doing. Now, I can usually fix those by just injecting a little more saline and massaging it. It is a little firmer to the feel, so for somebody who's used to Juvederm, they have to be warned that they may feel it. They won't see it. And it is not reversible like the other ones. The other ones, as I mentioned, there's an enzyme you can inject, but this one there is not. Now, then I mentioned Galderma, the Restylane family. They have regular Restylane. They have Restylane Refyne, which is for their finer lines. They have Restylane Defyne, which is for their deeper lines. They have Lyft, which is their one for creating volume. They have the new Kiss, which is for lips. And all have advantages and disadvantages compared to the Juvederm family in terms of how long they last and a degree of correction. So those are our fillers. That's the ones I will evaluate, and I tell patients I may use a different filler every visit you come, depending on what I see. You might come in one time and I say we're going to use Radiesse. The next time I say I would recommend we use this Juvederm product. I evaluate each patient based on what they tell me bothers them, as well as what I see. And quite often we'll combine it with a neurotoxin. So those are the things we evaluate and treat. These are all non-invasives, as I mentioned. They're treatments that we do usually the same visit, and hopefully that gives you some additional information about fillers. So thank you for listening.